Hi there, I'm Stuart Ralston, Chairman of the Board of Trustees of the Paget Association, and I'd like to welcome you to Paget's Disease Awareness Day 2026. Now, the theme of the Awareness Day this year is pain in Paget's disease, and of course, pain is the most important symptom and common symptom that brings patients to medical attention. Now, today I'm joined by Kathryn Berg and Dervil Dockrell, who were researchers responsible for the Pain in Paget's Disease study, which was funded by the Paget Association. So, welcome, Dervil and Kathryn.
Thank you.
Okay, so perhaps you could tell us a little bit about the Pain and Paget's disease study, what the aims of the study were, and what you found.
The aim of the study was to find out more about the causes of pain in Paget's. And in the study, we found that metabolically active Paget's disease was not actually the most common cause of pain. This was surprising because most treatment for Paget's disease targets metabolic activity, but it also might explain why some people's symptoms don't respond to bisphosphonates. The most common cause of pain in our study was actually osteoarthritis.
Okay, thanks. So, as well as documenting what we thought or what you thought were the causes of pain, I think I'm correct in saying as part of the Pain and Paget's disease study, you also used a technique called quantitative sensory testing or QST to find out more about the causes of pain. Now, can you say what that involved?
Of course, yeah. So the purpose of the quantitative sensory testing, or QST, is to quantify pain and sensation. When we performed QST on people with Paget disease, we tested the skin overlying the bones with Paget disease, and then we compared this with the skin overlying what we call a control site. So, for example, if somebody had Paget disease in this bone here, we would use that other side, this bone here, is the control site.
Okay, and so what did the QST, what did it show, and what did you do?
We repeated the test in 156 patients with Paget's disease, and we found that overall the skin overlying the Pagetic side was more sensitive to pain, to heat, and also to vibration.
Now, how very interesting. Now, Kathryn, you showed me rubbing your elbow there, on one elbow and the other, but I'm sure the equipment you used was much more sophisticated than just rubbing your hand in your skin. And so maybe you could tell us a little bit about the equipment you used and how it worked. Thank you.
We used this tuning fork, and this was to test for vibration. And then we used a little Medipin, which has a little pinprick at the top of it, and that was to test for pain. And then we also used hot and cold rollers, and we rolled these over the skin, and these were to test for temperature sensitivity. And then lastly, we used what were called Von Frey filaments. These are like kind of hair-like filaments. They're very fine. And these were to test for light touch sensation and for pressure sensation.
Okay, thanks, Dervil. Now, what do you think this means, these abnormalities or differences mean for people with Paget's disease?
What we think this shows is that people with Paget disease have a heightened sensitivity to certain sensory signals, and that might explain why pain is the number one issue to people with Paget disease. We're not sure why it is. It could be because of the changes in bone shape, bone structure, there's increased blood flow within the Pagetic bones, or it could be that metabolic activity. The other thing is that these changes could affect how the brain and spinal cord deal with sensory signals.
Okay, well, thank you, Kathryn. So, the QST has revealed some interesting and surprising findings, which actually have raised new questions. Do you think this could impact on the treatment of pain?
I think it could. We already know from a lot of other studies that bisphosphonates are not always that successful in treating pain in people with Paget disease. So that QST work we've done suggests that the treatments targeted at nerve pathways might be helpful for the management of pain in Paget's, and it might be worth trying those if pain doesn't respond to bisphosphonates.
Okay, very interesting. So, thanks both for taking the time out of your busy schedules to speak with me today. I think it's fair to say your research has given fascinating new insights, which hopefully will lead to improvements in the treatment of pain in people with Paget's disease. So, thank you once again. It's been a pleasure to speak to both of you today.
Thank
Thank
you.
you.